everybody, Dr. Matt Maggio here, Clinic Director at Peak Injury Solutions. Our mission is to help people that are injured and in pain become better educated and informed so they can get the best results and outcomes for their injury. What I want to talk about today in our video was the idea of knee scopes, or arthroscopic surgery on your knee, and really getting a better idea of what's going on, if you should have it or if you shouldn't. So in the US, the knee scope industry is a $5 billion industry. Many people end up going in for arthroscopic surgery on their knee, and there can be a lot of problems associated with that, and deciding if you actually need the knee scope or if you need to rehab it properly can really set you up for failure or for success down the road. So understanding knee scopes. Knee scopes, basically what they do is they go in there, open the knee up, and they clean up some debris. A lot of times that debris becomes arthritis. It could be some pieces of the meniscus that went free or some loose bodies. And it's the go-to treatment for knee pain. You know, a lot of times things won't even show up on an MRI and a doctor wants to go in and do an exploratory surgery and see what's going on. And that all sounds great, but the problem is you have to consider one question. Was there trauma or was there no trauma? That is key in any knee problem or any knee pain. Trauma is, hey, you got hit by a car, you fell in a hole, you hurt your knee, and I'd expect your knee to be a problem. But what we're seeing is so many people are having degeneration in the knee, in the tendons and everything around there, and they have no trauma. What happens is the knee gets beat up because other things aren't working correctly, and a lot of times there's an issue with the quads, the hamstrings, the hips, even the low back, and even an ankle problem in there. The knee gets beat up, gets damaged, it has pain because it's getting overloaded. So common sense says, hey, let's go in there and fix the knee. People end up getting these knee surgeries, but they're not any better, and a lot of times they're worse off, and they have to do a knee replacement down the road and cause bigger problems. So the key is always asking the question, was there a trauma or no trauma? If there's no trauma, surgery is probably not going to be the best outcome from there. You need to get a full functional evaluation and see what environment and what type of load that knee is under. The results and the outcomes are based off the trauma if you're not having trauma. So the key is getting to a doctor that can fully evaluate you and doesn't jump right into surgery and looks at you from a whole. So if you like our video, you like what you saw, do us a favor, send us a comment, give us a like or a share. And if you have any specific topics you'd like us to cover, send us a message. We're here to help.